I'm going to just.
All right. Hi, everybody. As you're joining, just give us just a few minutes and we'll get started. Maybe 30 more seconds to let everybody in the room. Good afternoon. Okay. All right. I think we'll go ahead and get started. So, hello, everybody. So glad you could be here with us today. My name's Allison Foster. I'm the Executive Secretary of Delta Mega. So this is our 100-year anniversary. Delta Mega was founded in 1924. So we decided last year to celebrate our 100-year anniversary is to host a series of presentations this year, looking at each decade of public health from the 1920s all the way to this decade. So we've had a really great set of presentations hosted by chapters of Delta Mega. So culminating with this one, which is going to be hosted by the Gamma Kappa chapter at St. George's University. So I'm really pleased to be able to present this for you. I'm going to go ahead because we've got a lot of presenters today, so I'm actually going to turn this over to my colleague Satish, and he will introduce everybody and get us started. So thank you very much.
Thank you very much, Alison, and welcome, Delta Amigo. On behalf of the Gamma Kappa chapter at St. George's University, we're delighted to have you share with this session with us. Well, first of all, let's begin with congratulations to 100 years of Delta Amigo Honor Society. But in this year, we also have other anniversary celebrations. Grenada is celebrating our 50th anniversary of independence, and our Department of Public Health and Preventive Medicine at St. George's University, the home for the Gamma Kappa chapter, is also celebrating 25 years anniversary. So a lot of celebrations that's going on, but certainly 100 takes the cake, literally as well. So our topic, aligned with the time frame that we're working with, public health in the 2000s, is essentially a reflection of who we are as a public health program, as a geographical location, and of course, the nature of our education, research, and community engagement experiences, and that is One Health. As an outline, we will discuss our chapter, St. George's University, the components of One Health, sustainable development, future directions and innovation, and some concluding notes. And we have with us, as One Health suggests, a team of colleagues across different disciplines that have come together to collaborate on this topic with us. By context, the Master of Public Health program at St. George's University was launched in 1999, which is quite timely as it relates to the nature of our topic today, which is in the early 2000s. So the lifespan of our program reflects the context of our presentation. The program began working with medical students, veterinary students, and public health, reflecting the human, animal, and environmental connections, and of course, also supporting undergraduate and graduate work as well. In 2010, we became accredited by the Council on Education for Public Health. In 2012, we established the Gamma Kappa chapter, and throughout that time, as well as part of the work that we engage in, we developed with the World Health Organization a collaborating center on environmental and occupational health. And in 2013, with the United Nations Framework Convention on Climate Change, a regional collaborating center focusing on mitigating, building resilience on climate events. This nature suggests that One Health is certainly synonymous with who we are. We have sympatrically located public health programs with medicine and veterinary medicine, as well as arts and sciences and environmental health programs. 2000s, the time frame that this seminar is reflecting, is also a chronological sequence of burdens that have reflected our experience and our exposures to health from the intersection with humans, animals, and the environment. Dengue, interaction with environmental factors, emerging infectious diseases that span across species and transboundaries. And these disease burdens we're familiar with, and we're continuing to experience challenges. And these diseases are not essentially only a human experience, but they may be sourced from the environment and animals, but also affect and impact the environment and animal species as well. So One Health is very much synonymous with the time frame that we are referring to. Also in the 2000s, the United Nations transitioned from the Millennium Development Goals, which was a struggle for countries to meet targets towards sustainability, understanding that we have a need to address the mere essential human aspect of our survival, our sustainability. So we have Sustainable Development Goals, and this is why we're connecting One Health with sustainability as the approach for this webinar. St. George's University, our School of Medicine, School of Graduate Studies, Research Institute, School of Arts and Sciences, School of Veterinary Medicine, student organizations and the communities we serve, our mechanisms for engaging with government agencies and international bodies, international collaborating centers, and our location here in Grenada allows us to reflect integrated interprofessional experience of public health with Gamma Kappa. So now what we will do is continue the conversation with the components of One Health from the context of humans, animals, and the environment. So we're going to have our colleagues join us, and each of our colleagues will introduce themselves, and we'll begin with humans with Dr. Prakash Ramdas.
Good afternoon, everyone. Thank you for this opportunity to present. It is my pleasure to be with all of you today. So with One Health, we have our humans, animals, and environment. What is interesting, they say great minds think alike. So I've actually chosen two diseases that I will present, and my two other colleagues from the other components that have chosen those two diseases, and we haven't discussed it. So I was quite fascinated that they did. So for One Health here, what is One Health? In essence, One Health, we have our three major components. So humans, animals, and the environment. So that's our triad. And of course, there is interaction with these three components. And we're trying to actually have health and prevent diseases by mitigating different factors, how these three different environments interact with each other. So as we can see here, simple, people living closer together, our population is growing so much faster. We're over 8 billion people. And of course, this is projecting to go on. There are more people, there are more animals. And then, of course, our environment obviously is not getting bigger. One of my colleagues is going to speak about that later. So that's our interaction. So the public health policies here, I have chosen two diseases that I'll give examples how our public health policies, how they actually are related to One Health. So we'll look at some surveillance and we'll look at two successful examples. So first we'll look at rabies. One of my colleagues is doing rabies. And there's another disease, Nipah virus, which my other colleagues is doing. So these are two diseases. We'll look at how they were successful with our One Health initiative in public health. So first, here we can see interaction with all these different sectors. So again, we have, if you guys can see my mouse, so we have our environmental health factors, we have our wildlife sectors, and then of course we have our human sectors. So these three major components, of course, we have our wildlife and our animals. Of course, these are all interrelated. And what's the whole goal of all of this? As you can see, all of these different policies, different scientists, private sectors, everyone, they're coming together, they're collaborating so that we can control rabies. And of course, we know rabies is not entirely controlled. We still get some few sporadic cases, but of course, it has been controlled to a very large extent. If we can go to the next example. Now here, again, we're looking at avian flu. Of course, we know we had quite a few pandemics in recent times, looking at our different strains and so on of avian flus. And again, we're looking at our different components. So again, we're looking at our ecosystem. We're looking at our, sorry, my mouse is, oh, good. Yeah, so we're looking at our ecosystem. We're looking at, again, like I said, we're having an increase in population, therefore more farm animals, and there's much more interaction with farmers and the animals, all right? And use of things such as antibiotics, which is causing resistance. So all of these are playing together where we're having these different diseases. So of course, all of these have to interact and collaborate so that we can control these diseases. Of course, I'm not going to go into too much details. I only have 10 minutes and I have a few slides. So let's speak a little about our emerging infectious diseases. So first, what is emerging infectious disease? So the definition is given a recent disease that has appeared or one that has been existed, but it's increasing in either incidence or it's in geographical spread. And what usually causes emerging infectious diseases? So it can be caused by a known or an unknown pathogens. And of course, I'll share different factors that relate to these pathogens. And then of course, we also have other factors. So here we have three major traits of pathogens. So increased virulence, which of course will speak about infectivity and disease. We have resistance of antimicrobial treatments. Again, as I've shown in 2 slides previously, there are a lot of antibiotics being used in these animals as well. And I'll speak about spillover, and obviously that's also interacting why we're having so many resistance with these different microorganisms, which is causing our emerging infectious disease. And then, of course, our expanded host range, increased interaction with animals and humans. Now, next slide, please. Here we have our spillover. So if we can see here, so we have this different animals here. So we have first domestic animals, and then of course we have wildlife, we have our captive, and also our free-ranging wildlife. So one of my colleagues is going to give a little more information on zoonoses. So here we have, these are actually causing our zoonoses. Then we have reverse zoonoses, where we're having, so from animals to humans, and then of course reverse, where we're having humans to animals. So for instance, we have an example of Mycobacterium tuberculosis. But of course, most of them are from animals to humans. And this is what we refer to spillover. And again, we have so many different examples here as well. So here are some factors that contribute to our emerging infectious diseases. Of course, with increasing population, we have globalization, increased travel, and there's so many airlines, so many flights every day, and there's so much interaction with humans. In 12 hours, a disease can spread from, one part of the globe to another part of the globe. Again, urbanization, increased population density. Some of these cities are so dense, you go to places like Malaysia, Kuala Lumpur, you'll see rising buildings. And then, of course, important factor where we have climate change, we have disruption of the environment. Again, one of my colleagues will speak more about this. And then, of course, I mentioned the antimicrobial resistance, and then our transmission from humans to animals and animals to humans. Here are a few notable EIDs. So, of course, our most recent global pandemic, we have COVID-19. And then, of course, in that pandemic as well, after probably like 1.5 years, 2 years, we had monkeypox, and which is still resurfacing again in recent months. We have Nipah virus. One of my colleagues is also going to speak about that. We had Zika, and then, of course, our avian flu. So these are the notable ones in the past, I'll say 20th century. So I'd like to focus now on a case study of Nipah virus. So Nipah virus was first identified in Malaysia in 1998, and it was discovered in the fruit bats. And again, because there's interaction with humans and agriculture, it was discovered in pigs. So from the fruit bats to the pigs and then to humans. Now the thing is with Nipah virus, it's recognized as a priority disease by WHO. Some of the symptoms, of course, it's a respiratory illness, and it can also have encephalitis, infection of the brain. And the reason why it hasn't become such a global disease is because it has a high case fatality rate. Now, the case fatality rate of Nipah virus, if untreated, is 100%. And if treated, it's around 80%. So you could imagine. So before people are even able to spread it, they die. So that's one of the reasons why it's kind of contained. Next slide, please. So again, as I said, it started in Malaysia and of course surrounding countries, which are their neighbor, Singapore, and then subsequent outbreak they had from Bangladesh. The interesting story with Bangladesh is from the fruit bats, workers, they'll go and they'll pick these fruits, and then they get interaction with these bats. And that's how it started in Bangladesh. And so as we can see, we're having this human to animals interaction. Next, please. Now here is some different transmission pathways, as we can see. So first in Malaysia, we had from the pigs, and then of course we had from the bats in Bangladesh, and then of course we also have here from horses as well. All right, so of course the affected host would be humans, and we have all these different illnesses that they can experience. So looking at our epidemiological patterns, so again, as we said, it's mostly confined to Southeast Asia, and because of the case fatality rate, but there are few cases, again, because of the seasons, and who are most at risk. So most at risk will be those who are interacting with these animals. So farmers, healthcare workers, and those who are more likely to be interacting with these bats. All right, so how can we control our Nipah virus? So again, because it has rapid transmission, it can go from humans to humans very fast. But one of the things that's limiting it is because of the high mortality rate. So they become confined, and because they're confined, they're unable to transmit it to many people. So that's one of the saving grace, I'll say, because of Nipah virus. And again, I said the treatment is very limited. And if you're untreated, case fatality is 100%. Now, of course, what's the significant impact? In Malaysia, when it started in Malaysia, there are so many pigs they had to slaughter. They had to slaughter thousands of pigs. Right? So you could imagine all these farmers losing all their animals, disruption of food, agriculture, and economy. So, like I said, WHO has it as a potential for pandemic, but of course, it is contained. And how can we prevent? So, of course, it is being monitored. So they have active surveillance going on. They have public awareness to be mindful with interaction with these bats. And then, of course, biosecurity with pig farming and so on. So they're having the stringent controls in healthcare settings to limit human-to-human transmission. All right, thank you so much, and my other two colleagues will continue.
Thank you, Dr. Ramdas, as a physician providing that human component. We now transition to Dr. Yusuf Yakubu as a veterinarian to share with us the animal component of One Health.
All right, good afternoon, everyone. I'm happy to be part of this panel to discuss on One Health. The One Health concept is not really a new concept. It's worthy of note that it's an old idea that was brought up by Sir William Osler, who is a Canadian physician and pathologist. And the concept was then promoted by Dr. Calvin Schwabe, who is also a Canadian physician and he was an epidemiologist and a parasitologist in the University of California. And the concept later evolved from one medicine to one health. A key role was really played by Rudolf Virchow, who is a German physician as well, who really brought up the idea when he realized that pigs could transmit parasitic infections such as Trichinella spiralis. So it's beyond cross-disciplinary collaboration and interaction between human medics, veterinarians, and environmentalists. It goes to the point where every other discipline has a role to play. Biostatisticians, microbiologists, bioinformaticians, everyone has a role to play in order to have or to promote a healthy environment, which relates or which translates to having healthy animals as well as healthy community. Now, zoonosis has been around for quite some time, but people have never really cared to know at the beginning where these diseases come from. There will be outbreaks and pandemics, and people wonder where these diseases come from. Sometimes we think they are spiritual things. Now, next slide, please. So zoonosis has been around, and this word zoonosis was coined by Rudolf Virchow, who is a German physician, and so he coined the word zoonosis, which means diseases that could be transmitted from vertebrate animals to humans. And from history, we could see that a lot of diseases that results to pandemics are of animal origins. And the CDC says 75% of newly emerging infectious diseases are zoonosis, and 60% of infectious diseases in humans are spread from animals. So we could see that zoonosis really presents a great risk to global health. Next slide, please. Now, if we look at the 14th century, there was this outbreak of bubonic plague known as Black Death, which was caused by Yersinia pestis, and it claimed millions of lives in Europe and as well some parts of Southeast Asia. It's been transmitted by the rat flea, and we also have the pandemic known as the Spanish flu. Next slide. The Spanish flu of 1918 also claimed millions of lives caused by influenza virus H1N1. And these are some of the zoonotic diseases that led to pandemics dating back to the 13th century, 14th century. And then as time goes on, we realize that we do have pandemics from time to time. Now, these zoonotic diseases have been classified in various ways depending on either the cause of the disease or the mode of transmission or the life cycle of the agent. Next slide. So several factors do play a role in the emergence of zoonosis. The earlier speaker, Dr. Ramdas, mentioned some of these: deforestation, antimicrobial resistance, intensified agriculture, climate change. All these play an important role in the emergence of zoonotic diseases. And based on the causative agents, zoonosis can be classified as being bacterial zoonosis, viral zoonosis, rickettsial zoonosis, parasitic zoonosis. So we all have different types of this, zoonosis based on the causative agents. And then we have other classifications based on, next slide, like the life cycle of the agent. So we do have direct zoonosis, for example, rabies that could be transmitted from dogs to humans. We could have metazoonosis or saprozoonosis, where you need an inanimate objects, like some of the fungal zoonosis or mycosis that could be transmitted from animals to humans via inanimate objects. We also have metazoonosis as well. So they could be, zoonosis can be classified based on the life cycle of the agents involved. Next slide. And then there was the classification based on direction of transmission from animals to humans. It's been referred to as zooanthropognosis, zooanthropognosis, and then humans to animals, anthropozoonosis. We have diseases like tuberculosis and influenza that could be transmitted from humans to animals. And then we have amphizoonosis that could be transmitted both ways. Animals could transmit, they could transmit it from human to animals and vice versa. So I would like to focus on the National Rabies Control Strategy that was developed and implemented in Tanzania. And I'm happy that we all looked at rabies in our presentations today. Now, this strategy was developed in order to see how rabies could be controlled and eliminated in Tanzania. And they came up with a national strategy where they started at stage 0 to stage 5. Now, stage 0 is all about the trying to get the available information they have in the country to the point of developing and adopting a national strategy for eradication. Then they implemented the strategy at district level, and then they widened it to a country level strategy. And they try to see that all dogs are either eliminated if they are stray dogs or they are vaccinated. So this is one of the successful strategies implemented towards the eradication of zoonosis, where the animal component is being taken care of, because if animals are not infected with this virus, then the risk of transmission to humans is being taken care of. Right. So this strategy involves public awareness and education on zoonosis, on the rabies and how it's being transmitted, mass dog vaccination campaigns all across Tanzania, and then capacity building amongst health workers, especially community health workers, surveillance and data collection about the disease, and then collaboration and coordination amongst health agencies, including veterinarians and other human health personnel. Now, the outcome of this strategy include reduction in the number of rabies cases in both humans and animals in Tanzania. And then there is increased community awareness and engagement in trying to prevent the disease. There is improved vaccination coverage in the country, and there's enhanced capacity and preparedness of veterinary and health services to respond to rabies outbreak. Now, this is just for Tanzania, and if we look at zoonosis at the moment, Mpox is there trying to spread across East Africa. And currently in the United States, you also have the Eastern equine encephalitis that's been reported in Massachusetts. And it's also been spread into other states around the Eastern coast. So we could see how zoonosis could really result to epidemics and potentially pandemics across the world. So integrating veterinary components into our One Health program can help effectively control and prevent zoonotic diseases like rabies, and ultimately improving public health and animal welfare. Thank you so much.
Thank you, Dr. Yakubu. And as we complete the trial of One Health components, we bring in Dr. Kerry Mitchell, environmental scientist, to speak about the environmental component.
Thank you very much. So yes, my colleagues certainly highlighted these important components of the One Health triad. And I'm going to spend some time speaking about the environmental component, but in many cases referring to some of the same outcomes, some of the same disease processes that are related to it. So let's move to the next slide. So it's very important to recognize the role of the environment in the context of health. Our environment serves a number of key purposes. For one, it's a reservoir. It's a reservoir for substances, nutrients, various organisms, including pathogens. And when we interact with our environment, we can impact that reservoir. So if we have situations where we have significant human pollution, for example, that's going to introduce toxic chemicals, it's going to introduce excessive nutrients, it's going to introduce, for example, antibiotics into the environment where they weren't there before. And the accumulation of these pollutants can ultimately lead to disequilibrium in the environment. Our environment also supports ecological processes, and some of these processes are essential, very, very important for human services. And our actions, again, with the environment can serve as stressors that impact some of these processes. And finally, our environment plays a very key role as a health mediator. We have transference of genes, chemicals, pathogens, and these can ultimately impact the health not only of humans, but also of animals and vegetation in the environment. And again, that disequilibrium that can cause can certainly lead to adverse health impacts. Next slide, please. So indeed, the role of the environment is very clear. And we have looked at some examples in previous slides, but it's important to note that normally we have balance, we have equilibrium or homeostasis. The issue arises when we introduce these stresses, the pollution, the change in land use. These days, quite a lot of focus is on climate change and how that ultimately can impact our environment. And of course, its association with different things like biodiversity loss and so on. So when we look at two key areas, and I'll just highlight two examples just to sort of make the point, we can think, for example, of land use change. Now, we are changing the way we use our lands. In other words, areas that would have previously been identified as forests or protected regions are now being converted to agriculture and pasture land. That changes the ecosystem significantly, and it leads to changes in biodiversity, and ultimately that can lead to a rise in certain types of zoonotic diseases. So when we think of some of the recent epidemics and pandemics that we've had, we can certainly trace that likely to some change in land use. For example, avian influenza is associated with changing land use. MERS is associated, for example, with changing land use with respect to camels in the Middle East. Some suggest, and of course this is still a source of debate, but the origins of COVID-19 may very well be associated with the way we use or interact with animals from a domestic perspective. When we think of climate change, for example, that climate change is considered a threat multiplier. In other words, a lot of the threats already exist, and that's the way our environment works. Some people, we have this ebb and flow, but climate change tends to exaggerate a lot of these environmental issues. So it poses a threat due to that exaggeration. Typically, when habitats are altered, microorganisms and macroorganisms are going to migrate and they're going to move. So we can take an example, for example, of mosquitoes in certain parts of the world. Let's say the mosquitoes that are associated with malaria. In Colombia, these were typically found at lower altitudes, and the issue with the disease tend to focus in those areas. However, with climate change and rising temperatures, we now see that these mosquitoes are now becoming quite prevalent at higher altitudes. So now we're dealing with diseases in regions that aren't historically associated with these diseases. And not only does this happen with altitude, but it also happens with latitude. So we're seeing a lot of these vector-borne and mosquito-borne diseases now proliferating at latitudes where previously that would not have been possible. So we can see that as we exercise stress on our environment, we ultimately cause these changes that lead to differential progression in disease. So our next slide will look at one of the examples that was previously mentioned. And we want to think of it from this perspective. Do you see the connection? In other words, is there a connection between deforestation and encephalitis? Now, of course, Dr. Ramdas told you what that disease was. He spoke about the Nipah virus. And of course, one of the symptoms of this virus, or of the disease that it produces, is encephalitis in mammals, humans and other mammals. So initially, when this disease started to become common in the area, many researchers thought it was Japanese encephalitis. They did not associate it with the Nipah virus that was prevalent at the time because there was no obvious connection. But there is a connection. Take a look at the next slide. Look at the flow. First, we started with rapid agricultural expansion. And one of the key, now this was due to economic reasons, of course, because palm oil, of course, has very high economic value. So the government, of course, instituted policies to ensure that they can now produce a lot more palm oil for export. This rapid agricultural expansion led to deforestation because they took what have been previously forest lands and now changed its use for agricultural use. Now, this loss of forest, which would have been the natural habitat for fruit bats, now extended the natural habitat, now bringing it closer to human activity and human settlements. So the bats would have normally been in the forest, out of contact with humans, are now closer to humans, closer to their settlements because we changed their habitat. Now the bats started to interact with food products, in this case fruit, that not necessarily in this case the humans were eating, but instead the pigs that were being reared in that area as livestock were eating. They were eating these contaminated fruits, and they were the first, let's say, victims of the Nipah virus. So the pigs ate the contaminated fruits, they contracted the virus, they started developing some of the symptoms, including the encephalitis that was mentioned previously. Humans in close contact with these pigs also started to develop the disease. And ultimately, well, as we know, the rest is history. As Dr. Ramdas mentioned, this ultimately led to very significant economic decline. So we can see that dealing with the issue from this systemic perspective not only helps protect our health, but it also helps protect our economic prosperity, because they ultimately had to cull over 1 million pigs to contain the situation. And not only did they have to cull pigs, but humans also died because the disease, as Dr. Ramdas mentioned, if untreated, has 100% case fatality. So we can see here that whilst deforestation is not typically associated with a disease that results in encephalitis in humans and pigs, there was a connection here, a very, very direct connection. What's the key point? If we have to approach health from a One Health perspective, we have to understand that human health is intricately related to animal health and environmental health. And if we have to address our health issues from that perspective, it requires us to use systems thinking, understand and address those complex interactions that exist between these three components of the triad. Thank you.
Thank you very much, Dr. Mitchell. As we conclude the One Health components and now transitioning and connecting with a One Health approach from a sustainable perspective, with Dr. Lyndon Telsford.
Okay, thank you, Dr. BDC. So we're going to turn our attention to the One Health perspective and look at how it is related to sustainable development. And as we already heard, the One Health approach focuses on that interconnectedness between humans, between animals, and I'm also going to add here plants and the environment. And the One Health approach is directly related to sustainable development. Now, when we use the term sustainable development, we are talking here about the well-being of the current generation. We're talking about the social and the economical well-being of the current generation, and also considering the future generation. So sustainable development goals bring into focus aspects that we must consider in order to ensure the well-being of the future generation as well as the intact generation, ensuring that we have a good or that we can enjoy a good quality of life. So One Health in itself relates to several of the Sustainable Development Goals. For example, Goal 3, we speak about health and well-being. We've heard a lot about zoonotic diseases that can implicate human beings, but they also implicate animals. We already spoke about antimicrobial resistance that can implicate humans in a very significant way in terms of the efficacy of medical care and treatment. Then we can consider Goal 6, which speaks to clean water and sanitation as well. And in this goal encourages water resource management and sanitation initiatives. We can think about life on land, and here we can consider sustainable practices that must be instituted to ensure that there is benefits, not just for humans, but also for animals and the wider environment. And then, of course, the big one, as Dr. Mitchell just spoke about, climate change as well. And here we understand that it is important to put necessary measures in place from the perspective of the environment as well, environmental management, to ensure that we mitigate and also adapt to climate change. And Goal 2 also speaks to zero hunger. This addresses livestock health and the link to foodborne illnesses. So as we go on, we can see here that related directly to health, goal number 3, we spoke about several of the things that we need to focus on. We spoke about reducing mortality, ending epidemics, ensuring access to reproductive health services, addressing substance abuse. We can talk about road traffic accidents, etc. here. And if we go on to slide, please. Clean water and sanitation. We want to ensure availability and sustainable management. And here we can speak about ensuring that we have proper sanitation and hygiene, we reduce water pollution, address water scarcity. Now, the question that probably we'd want to think about here is, can plants and animals or even atmospheric conditions implicate the quality of water that humans consume? So that's something we need to think about. Slide, please. And then as we think about climate change, we need to take urgent action to combat climate change. Here we are thinking about several or the role of the environment. And this is very evident in climate change. But also, do plants and animals have a role in mitigation and adaptation as well? So that's something that we should think about carefully. That's how we incorporate the One Health concepts. So as we go on, the One Health approach underscores again the interconnectedness of the health systems, simultaneous impacts of shared environment. We have to think about when something happens or there is a shift or imbalance in one system, it implicates the other systems, and that's what we've heard before. And there is therefore a call for a multidisciplinary approach. So here we have to think about disease prevention from a holistic approach: food safety and security, antimicrobial resistance, conservation of the environment, and as I said before, climate change mitigation and adaptation. All of those requires the inputs of multiple disciplines. Slide, please. So the interconnection between One Health and the Sustainable Development Goals focus or it galvanizes around integrated and a holistic approach that must be taken with multi-sectoral partnerships, not just at the national or local levels, but we have to think about the regional and the international levels. We have to think about global challenges. Often the diseases that we just spoke about do not remain in one environment, but transcend across boundaries and implicate people in other countries as well. So we have to consider, how do we build capacity and ensure that our societies are resilient, and of course, including everyone, leaving no one behind. So here are some examples of One Health in action. And we can think about zoonotic diseases, for example, COVID-19, in which bats are assumed to be the reservoirs And this call for integrated systems. We have to consider how all of the systems in the One Health framework work together. So if we think about animal health, for example, we have to think about research on wildlife as potential hosts. We also need to monitor and control human-wildlife interactions. Then from the human perspective, we have to think about veterinary and public health organizations, how they work, do they function in sync, and how they surveil, detect, and respond to these kind of emergencies. From the environment perspective, we have to think about this shift in terms of human settlement, how natural habitats are being managed or whether they are conserved or preserved and so. So we have to think about those as well as things like sustainable land management as well. Slide, please. So another example is antimicrobial resistance. Because of the overuse or misuse of antibiotics in healthcare and animal husbandry, we have pathogens being more resistant to treatments. And here again, all three areas of One Health or dimensions of One Health come into play. So human health, we have to think about the judicious use of antibiotics. Same in animal care, animal husbandry, we have to think about that as well. In terms of the environment, we have to think about improving waste management practices, monitoring environmental antibiotic levels in the environment as well, because people can actually be exposed to antibiotics through the environment outside of medical care. So that's another example showing the need for integrative management of these problems. Slide. So for our case study, let's look at the impact of deforestation on malaria incidents. And many tropical regions face challenges with managing malaria. We know of several countries, including in the Caribbean region, several African countries and other regions. And largely, the problem results from the loss of tree cover and the disturbances of the natural wildlife habitat. And this can impact on the survival and growth of mosquito larvae, as well as the loss of natural predators. And at the same time, while we are removing trees or there is deforestation for settlement, the process of urbanization also increases human exposure to mosquito bites and the risk to malaria transmission. Slide. And so we have to look at response. Slide, please. Response actions. What do we do? Now, many countries, and if you look at the literature, have embarked on reforestation and afforestation projects. Community education and engagement is also very important, as the population need to understand its risk and how they can change the situation to reduce the risk to their own health. And integrated vector management, that is also important and has been promoted in several countries to address malaria incidents. Slide, please. So what are the expected outcomes and what have been the outcomes? Reduce malaria incidents, enhance community resilience, and of course, sustainable development. In the absence of people being healthy, there cannot be sustainable development. So of course, that's a natural outcome from the management of those diseases. And so the One Health approach provides a holistic context here. We're looking at disease prevention, sustainability, and of course, stakeholder collaboration, partnership between the medical, public health, environmental science, community development workers to ensure that there is a comprehensive approach to the management of disease. Slide. But there are, of course, some challenges and opportunities in adopting the One Health approach. So some of the challenges would be the lack of coordination. Sometimes we have organizations operating in silos, and the efforts are very much fragmented, and therefore there is not cohesion in terms of the solutions. And then funding, several countries lack adequate funding, and therefore the system again remains insufficient and very much fragmented. And then the absence of policy support as well. There is not always alignment with the One Health approach in policy development, but there are some opportunities that we can embrace. For example, innovation, the use of technology to analyze data set, to collect data, and so predictive modeling, again, sustainable practices that we can use to efficiently address environmental risk factors. So those are opportunities that we can embrace. Research as well. Integrated surveillance systems, disease pathogenesis. These are things that we can embrace as opportunities to address the problems. And of course, policy development. We can always institute policies for things, for example, data sharing, joint research initiative, and coordinated research and response strategies. Slide. So what do we recommend, or how can we move forward? Certainly, policy integration is important. We need to integrate the One Health principles into national and international policies, and ensure that there is certainly a coordinated approach in policies that are being developed and implemented. But then education and training is also important. We need to advocate for that training so that people understand the One Health approach and that interrelation between the elements of One Health. And certainly collaboration between governments, NGOs, academia, and the private sector. So those are important for moving forward as we seek to build that relationship between the One Health concept or approach and sustainable development. Thank you.
Thank you very much, Dr. Telesford. And the segue now with the challenges and opportunities was identified as technology, education, training, and collaborations. Let's explore a little bit further now. One of the technological applications currently and projectively would be that of artificial intelligence. Several of the functions of One Health and public health integrates and can integrate AI components. For example, disease surveillance. Increasingly, AI is utilizing big data and in real time predict and analyze situations that's occurring. Diagnostics, both in humans and animals, are enhanced by artificial intelligence. Tracking of diseases, forecasting, modeling, predicting, analyzing patterns, also using large database machine learning as well as artificial intelligence. Real-world examples. During the COVID-19 pandemic, artificial intelligence was used to predict and assist in tracking. For avian influenza, understanding bird migration data, AI is also detecting environmental risk factors for the disease. And of course, as was mentioned with antimicrobial resistance, patterns of resistance can then be predicted to guide the use of appropriate antibiotics and also mitigate the effects of resistance. One Health and AI, well, if we're integrating humans, animals, and the environment, we also have to integrate AI as part of the triad or maybe the quadride of stakeholders involved to provide more accurate predictions, faster diagnostics, and better preventive strategies on the burdens that we share. Education and training was mentioned. For One Health, a curriculum on One Health is critical, and that curriculum, as we all represent ourselves, persons of different disciplines, connecting to offer an education opportunity. The integrated approach has to be strategically applied, ranging from zoonoses, food safety, environmental health, and epidemiology, while also incorporating policy and socioeconomic concepts. Collaborations, understanding who are your collaborators, who are your stakeholders, and practical components from fieldwork, case studies, and simulations, applying aspects of theory into real-world context. The interdisciplinary training programs should and would effectively break down silos traditionally instituted as part of educational programs. We offer joint degree programs, for example, at St. George's University, where you can pursue medicine and veterinary medicine with a combined degree in public health. This interdisciplinary training allows for equipping graduates with the skills to cross sectors and integrate with domains as well. And of course, interprofessional education, providing different perspectives where different disciplines actually learn together. They learn together, they work together, they can solve the problems together as well. And we have with us an example where we invite Dr. Tessa Sensei to share with us the experience at St. George's University.
Thank you very much, Dr. Bidesi. Good afternoon, colleagues. And as it relates to interprofessional education, I believe the One Health approach situates us perfectly for doing that, right? IPE, as we call it, is really learning from, we're learning about, from, and with each other. And as Dr. Bidesi just said, we have students from different academic backgrounds and pursuits with us. So we have students in a standalone MPH, we have the DVM MPH students, and we have the MD MPH students. But interestingly, we also have a range of different students in that background, that backdrop of the IPE. So what is important for us here as it relates to interprofessional education and merging or marrying that with the One Health approach is a kind of exposure that we are going to give to our students. And we take exposure at different levels. So we have exposure just at the face level where we bring the learners together, and we do have interprofessional team activities where the students come together. Then we have the immersion where they actually get involved in an activity, and we have the mastery that enables them or facilitates them or puts them in a position where they have to engage in critical thinking and problem solving in real life situations. So what are the key components of the interprofessional education? Here we see a framework that is provided by the Interprofessional Education Collaborative, and we see 4 areas there, and under each area there are a number of sub-competencies, all right? So the first one we're thinking about here is values and ethics for interprofessional practice. When we think about that, we're talking about working with individuals from other professions to maintain, and Dr. Bidesi did mention that, to maintain a climate of mutual respect and shared values. So each profession comes with its own list of values. But as we would appreciate the One Health approach enables learners to bring all of these values together and to engage with shared values. The second one speaks to roles and responsibilities, where learners are going to use knowledge in their own roles and those of other professions to appropriately assess and address the healthcare needs of the different populations that they serve. Okay, and the third one is interprofessional communication, which we see as a core competency. Communicating with patients, communicating with families, communicating with communities and other professionals in a responsible manner that supports a team approach to maintain health and the treatment of disease. And the final one is team and teamwork, applying relationship building values and the principles of team dynamics to perform effectively in different team roles and to plan and deliver patient population centered care that is safe, that is timely, efficient, effective, and equitable. So that brings us into the question or the situation as to how do we go about implementing. Now, the implementation must reflect the goals or the aims, yes, the learning outcomes that we would want to achieve. So implementation may vary across educational programs. For us, we have engaged, as I said, in interprofessional teams where we actually take a real life situation, a real life problem, and have our students who are coming from different academic backgrounds, different training, and having them engage with professionals from different areas to address a public health issue. All right. Important here, though, is the fact that for every activity, there must be an assessment for and of learning. So it must be strategic. We must be very cognizant of what we are hoping to achieve from this implementation, from this engagement in interprofessional education. And all of that is couched on the fact that the IPT facilitator must mediate learning. So we have to get away from the sage on the stage situation where instructors, where professors are basically lecturing at students and having them actually engage active learning, meaningful learning, and the teacher must now take a back stand and mediate that learning. Dr. Bidesi, I turn back over to you.
Thank you very much, Dr. Sincere. And as we continue with the interdisciplinary training initiative, recognizing this is about creating the workforce that we need to be able to tackle the global challenges that we have been discussing throughout this webinar thus far. These integrated elements from the education system prepares our future professionals, and we think holistically from a sustainable perspective and a One Health perspective as well. Now, as it relates to the whole aspect of collaboration and partnerships, we have many examples of how that can occur through international health regulations, veterinary services, antimicrobial resistance, food safety initiatives. All of these are examples of what we call the quadripartite. And we'll like to invite Dr. Tonya Frame now to share with us these examples and experiences of collaboration required in One Health.
Good afternoon, everyone, or good morning, based on where you are, or good night. And congratulations to the Delta Omega Society on your 100th anniversary. So I'll talk a little bit about the global health security initiatives, but just noting that when we talk about global health security, we're talking about proactive and reactive activities that are required to minimize the danger and impact of acute public health events that endangers people's health, really, across geographic regions and international boundaries. And so, as Dr. Bidesi mentioned, there is the quadripartite grouping, which involves the World Health Organization, the Food Administration, FAO, a number of organizations, which I'll get to when I'm looking at the organizations and networks. But these are essentially world UN agencies that focus on implementing the international health regulations. And so a number of initiatives at that level, at the global level. And so the international health regulations is one of the main instruments or frameworks and activities. Then there's the performance of veterinary services, as well as at other country levels or regional levels. You have the Canadian Integrated Program for Antimicrobial Resistance surveillance system, and they collect, analyze, and communicate trends in antimicrobial use and in antimicrobial resistance for select bacteria for humans, animals, and retail meats across Canada. You have the European Union Integrated Approach to Food Safety, where they look at safety across all the food sectors and feed chain, and ensure that any food being imported into the EU also meet the same standard as foods produced within the EU. And then coming out of the quadripartite grouping, there is the One Health Joint Plan of Action. Now, these initiatives really highlight the benefits of One Health across the spectrum of disease control, from prevention to preparedness, detection, and a response for a range of health hazards. However, to maximize and extend these benefits, we do need to have more effective and sustained operation of One Health. So while we have a number of initiatives, the implementation of the operationalization is really a huge gap. And we saw that during the COVID-19 pandemic, actually before the pandemic, there was the tripartite. And so when we saw what happened as a result of the pandemic and some of the gaps that occurred, then there was a clear need to involve other agencies. And so it shifted from being the tripartite grouping to the quadripartite grouping. If you take a look at the table, you'll see that the majority of these applications or initiatives focus primarily on prevention, preparedness, and detection. There's limited initiatives around the response aspect of things. And so that's a gap that needs to be addressed. In terms of the organizations and so forth, the main organizations is this quadripartite grouping. However, there are networks across other global networks. Most of the networks are not global. There are, in fact, most of the networks being located in North America and Europe. This itself presents quite a problem in terms of where the resources are allocated and where the decision-making is concerned. So as part of looking at this One Health from a global perspective, we also need to be concerned about equitable approaches, ensuring that there are the involvement of stakeholders, that low and middle income countries are well represented, that there is adequate funding for these One Health approaches across borders and so forth. Then it's also important that a lot of these approaches are not just focusing on emerging diseases, emerging infections, and novel pathogens, such as COVID-19, but also focusing on endemic infections and neglected tropical diseases, and other issues such as food security and so on, where there has been this gap identified in research, but the resources and the activities have not followed suit. So just in closing, to note that taking a global health approach to One Health is quite appropriate based on how much we travel. We say that the world is a global village, and it indeed is. We've had many examples of this. And so I think it's incumbent on all of us to sort of do our part in health security. It is quite a challenge because it is also very inconveniencing for us in terms of limitations to travel and economics and all of that. So I would like to end here and thank you again for the invitation.
Thank you very much, Dr. Frame. And as we conclude our Gamma Kappa chapter from the Caribbean and Grenada, we'd like to dedicate a little token to our Delta Omega Honor Society as a whole.
All right. Allison did have to jump off at 3 for a different appointment, so.
From the Gamma Kappa chapter at University Grenada, for
All right.
100th anniversary.
100th anniversary, here we go.
Celebrate public health. We hope time was well spent. A One Health approach to answer the call as is health for one, health for all. Thank you, guys. Appreciate you guys joining.
Thank you. Bye now.